Alright. So, my name is Brent Sims, and I'll be your nurse for today. And I'm going to be doing what we call a physical assessment, and that's from head to toe. We're looking at everything from your hair clean up down to your hair, your toes.
Okay.
So, can you tell me your name and date of birth, please?
Name is John. Date of birth is 12/09/89.
Do you know where you are?
I'm at Baptist Health Nursing School.
Do you know who the current president of the United States is right now?
Joe Biden.
Joe Biden. Alrighty. So he's oriented to person, place, and time. And you are verbally responsive and awake and alert. Your mood seems very pleasant. Are you happy today? Happy to be here? I know nobody wants to come to the doctor. I know.
Yeah, it's okay.
But I'm just trying to make it the best and easiest transition as I can.
Oh yeah.
So I'm gonna just take a look at your head. Okay, just hold up, look straight up at me. All right, we're looking pretty oval. Are you having any pain?
No sir.
No pain. Okay. Well, normally I would check your vitals, but since I don't have a vital sign machine, but I do your blood pressure, your temp, and all that good stuff, your pulse ox. So next I'm gonna start by examining your head. Okay.
Okay.
All right. I'm gonna put this here. And we gonna just looking around, looking for any lice, bugs, any dry spots, any bumps. Look on this side here. Alright. Okay. And look up by your line. Like the cut, man. Who cut your hair?
Me.
You didn't.
Yeah, come on here.
Okay. Is that a cut? Oh no. It's just a little.
It's probably from the mask, probably.
From the mask. Okay. Alright. I just know COVID is around,
Right,
so I have to check on all that.
Yep.
Well, your scalp has no bumps, no bruises, no lesions, anything of that nature. So now I'm gonna check your pulses and see if they're strong and regular and all that.
Okay.
So first we're gonna start with the temporal pulse.
Okay.
Alright, it is bounding and equal and strong. Next I'm gonna look at your carotid. This one. Alrighty. Okay, that's strong, both bilateral and pounding. Next, I'm going to look at your face again. And by me doing this, I'm making sure it's symmetrical, even. If you bump your nose or something, you got a little long kind of nose. You wear glasses or anything?
Mm-hmm.
You do? Mm-hmm. What about contacts?
Sometimes.
Sometimes. Okay. Just those two?
Yeah.
What about your eyes? Any prosthetics or anything? Okay.
Never eyeballs. Never.
Never eyeballs.
Yeah.
Well, we just have to ask and make sure.
For sure.
All right. So I check your eyes. And next, let's go down to. Let's see if you make some facial expressions for me. Can you do that? All right. Gonna check out some nerves. All right. Open up your. There you go. Smile for me. Clench your teeth real good. Alright. Okay. Let's see. With that, let's just check out your duration. Duration. Your ocular eye movement. So
Okay.
I want you to follow the pen.
Okay.
And we're just testing the cranial nerve, the EOM, and it tests nerve 3, 4, and 6. Alright, so just follow this pen line for me. Alrighty. Now next I'm gonna look at your skin, see if any turgor. Alright, oh. I got something on your eyes.
Okay.
Let's look at your pupils, buddy.
All right.
Alright. And can you tell me what I'm touching you in your face?
Left cheek.
Alright. Just checking and making sure.
Mm-hmm.
Alright, next let's check out your sinuses. You have a frontal and your maxillary.
Okay.
So first we're gonna start right here in the crest of your nose. So I'm just gonna put my hands right there and let me know if it hurts anything.
Nope. No pain. Fingers are cold, but no pain.
I'm sorry, washing your hands all day in this
Mm-hmm.
place. Let me make sure I'm in a good spot. Alrighty. Okay. Let's see. Can you hold your head up for me? Make sure your trachea's intact. Yes, it is, and it's aligned and symmetrical. Alright. I don't see any discharge in your eyes. I actually, I know prosthesis. Can you flare out your nose for me? There you go. And a look. Make sure it's good and clean. Okay, can you hold your head down for me? I'm gonna check out your ears too, okay?
Mm-hmm.
Pull that back down. You got a little wax, but a little wax is normal. Let's check this one. Alright. Okay. Let's see, you checked your ears, and now we're gonna look at, I'm gonna look at your eyes. I forgot to look at your conjunctiva and sclera. I don't see any redness, any edema. Your pupils were roundly reactive to the light. I did that earlier. Conjunctiva is pink and moist. Alright. And when I was testing it, name badge. Let me have you look at this name badge. This is testing for the second cranial nerve called optic. Hang it. I know it's cranial nerve too. I forgot the exact name of it. But you put your glasses on for me, and could you read the top of this line here, sir?
Baptist Health College, Little Rock.
All right. Thank you, sir. Let's put it down. All right. And earlier when I was checking your eyes, was it any? You having any pain in your eyes when I was checking cranial nerve 3, 4, and 6?
No, sir.
All right. Next, let's give you the whisper test.
Okay.
And it's testing cranial nerve 8.
Okay.
So I'm gonna just step over here in this corner, and I'm gonna whisper, and I want you to repeat back what I say, and I'm gonna go in this corner. I want you to whisper what I say. Okay.
Mm-hmm.
Apple.
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 Alright, so you passed the cranial 8 nerve test. So let me take another look at your nose. I already looked at your nose. Let me look at your tongue. And can you stick your tongue out for me? That far you can go.
Mm-hmm.
Let me take a look at your ovea. Alright, so you do still have your tonsils?
Yep.
Alrighty. Can you stick your tongue out and move it side to side for me?
Alrighty,
Thank you. Just making sure it's there. Alright. Let me get this bag of chips. I'm gonna put this up to your nose, and this is cranial nerve 1. And I want you to tell me if you can smell it.
Them smells like Cheetos.
Just like Cheetos. Alright. Sounds like a plan, my man. Next, I want you to lay back for me, and we're gonna take a look at your belly. Is that okay with you?
Mm-hmm.
Alright, first thing first, I'm just gonna pull your shirt up,
Okay.
just a little bit. I just need to inspect and look at your stomach, okay?
Go ahead.
Alright. We're just making sure we don't see any lesions. Your belly button is intact, it's centered. Okay, so first I always look, and now I listen, okay?
Okay.
I'm just gonna listen to each quadrant slowly. Just listen for some battle sounds. Make sure your battle sounds are active.
Alright.
Just letting you know what's going on. So.
Yes, sir.
Alrighty. Now I'm just gonna feel from quadrant to quadrant. Let me know if you feel any discomfort or any pain, okay?
Okay.
That feel okay?
Mm-hmm.
Alright. I'm sorry, I know my hands are cold.
That's alright. I'm getting used to it.
Alright. pain?
No, sir.
Any pain?
No, sir.
Alrighty. Okay, everything looks symmetrical. I'm gonna just take one good deep breath for me. Alright, I'm just checking to make sure you have a symmetrical, your long span was even. Alright, you can sit up from the butt. Take your time, take a step back here, and I'm gonna look at your spinal cord, make sure it's intact. Alright, it works for me. Okay, I want you to just relax for a hot second. And we're gonna take a good listen to your lungs, okay?
Okay.
Alright. Alright, go behind you and listen. Alrighty. Lungs clear. Any wheezes, any crackles, no shrider. Next, I'm gonna listen to your heart, okay?
Okay.
Then at the end, I'm gonna listen to your apical pulse for 1 minute.
All right.
Now what I'm gonna do is I'm gonna listen to your apical for 1 full minute, okay?
Mhm.
And I'm gonna use the timer off my phone. Alright. Alright. Heart rate was 92, which is within average, so we look for no 60 to 100. When I listened to your heart, everything was bounding, and I forget what's the exact term of the medical term I'm looking for. Your rhythm and rate was strong and bounding. I didn't hear any murmurs. Everything was bounding.
Good.
Next, let's check out your lymph nodes. So we're gonna start. I'm gonna just come on the side of you, okay?
Mhm.
All right. I'm gonna just take my fingers and I'm gonna go to each lymph node, okay?
Okay.
So first, I like to start back here, pretty much behind the ear, and here is what we call the post articular node. And I'm just feeling around for it. It's like normally it's like right there behind the ear. And then I go down just a little bit into the back. And this lymph node we call the occipital. And I know I'm going backwards, but I learned it backwards, so that's how I'm performing it, so I apologize.
Alright.
And from there we go over to the submandibular, and it's like almost about mid and even with your ear right here. And I just use these two things to palpate. And then I come back down here by your clavicle bone. And right behind it is the posterior cervical lymph node. And palpate for it. And then I come down and I do the supraclavicle, just like right here, pretty much on your clavicle. And then I come over here and I do the posterior anterior cervical lymph node. It's gonna be more toward the front a little bit. And then I find your start with an S. Submental. And it's like pretty much right up under your chin is what I'm palpating. You feel it. Alright. And then I come back up from your chin over to the front of your ear a little bit and I'll check out for the tonsillar lymph node. I hope I pronounced that correctly. I know it starts with a T, like T-O-N something. And then right a bit closer to your ear is the preauricular node. Because most people start from where I just ended, but I went the opposite way, so that's why we did the post. Alright, cranial nerves, I made sure you did the first one, you smelled for me. Did the cranial nerve 2, which is reading the badge. We did 3, 4, and 6, because those 3 go together. And I made you follow the pen, I looked at your pupils, make sure your ocular range of motion with the going in the line. I made you clench your teeth. Oh, I forgot. I'm gonna put my hand under your chin, and can you push down for me? Alright, I'm gonna put my left hand on your right cheek, and can you turn into it for me? Alright, I'm doing it the other side, turn into it. Alright, thank you. I made you smile. Can you blow your cheeks out for me? For cranial 7, thank you. We did the whisper test in the corner. I don't have anything for you because I think I'm missing swallow. Yeah, swallow. Can you just swallow for me? I just want to assess how you swallow. Is it painful or anything? Nothing like that. Okay. Can you like roll your shoulders back like this for me? Okay. That is. And I did the tongue movement. Can you do your tongue again? Okay. The tongue one is cranial 12 and the shoulder is 11. Alright. Just repeat after me. Brent Sims will be an RN next.
Brent Sims will be an RN next.
Alright, I just wanted to test your speech. And we do it when you normally first come into the room, but I forgot to do it, and that's cranial nerve 10. Okay. Any questions? Let me see. Oh, I'm gonna stand out to the side. Can you hold your arms out for me? Alright, can you hold it, go up to the ceiling? Can you bring it back down? Alright, I'm gonna take my hand and put it in this hand, and can you go up and I'm gonna hold against resistance? Alright. Okay, now go down. Thank you. Do the same to this one. Push up, come down. Okay. Now I need to do the strength test. I'm gonna put my hands in your hand, my fingers in your hand. I'll put 2 of them. Okay. And I want you to squeeze for me.
Okay.
All right. Thank you. Now push. I'm gonna push against you. All right. Now I'm gonna pull you. Okay. And I also forgot to check at your pulses.
Okay.
Let's do the radial.
Sorry about that.
Oh, it's okay. It's okay.
There you go, sir.
Let me just make it work. We got strong and bounding. +2. Now we're gonna check the brachial right here in the middle of the arm. Alright. Can you kick your legs out for me? Just kick both of them out at the same time. Just kick them for me. Alright, bring them back down. Alright, now I'm gonna put my fingers up under your knees, and we're gonna test for the popliteal. I think I'm pronouncing that correctly. Pulses. And they are bounding +2 equally. And now we're gonna go to the inside of your ankles, and this is the posterior tibia. Right here on the inside, gonna check them. And they are bounding bilaterally +2. And then we do the dorsal pedis. I check for the pulses on top of your feet. They are bounding bilaterally +2. Now I'm gonna just take my hands and put them on your feet, and can you kick them up? There we go. All right, now push it down. Alrighty. Let me see. And I'm not mistaken. Pulses, feet, ankle, wrist, brachial. I checked the carotid in the beginning of the video. Brachial, femur. Let's check the femur. So I'll have my resident or patient lay back, and I will go on the inside, put my fingers in here until I find both his femoral pulse or femoral pulses. And ideally we want them bounding and +2 and bilateral. You can raise up. And if you have any questions for me today, Mr. John?
No, that's it.
All right, well, I'm gonna go out, fill the report, and I'm gonna holler at my doctor, and he'll see you shortly.
Okay.
Thank you.
Thank you.